Good afternoon, today's April 29th, and today I'll continue to be talking about the coronavirus. So the first piece of news that I'd like to talk about is that yesterday, Mr. Trump declared that meat packing plants were critical infrastructure that should be kept open during the pandemic, which sent a powerful signal that protecting the nation's food supply was a federal priority. So although the executive order did not say how they would keep plants running in the middle of outbreaks that have sickened thousands of workers, and they have not addressed some critical questions about whether the plants should test all their workers for the virus before opening. This does seem like a turning point to protect the meat packing plants during this time. So previously, I've already talked about how they were a critical part of the food chain, which were in danger, and if one closed down, it would affect thousands, potentially tens of thousands of people. So, while this does not explicitly mandate how the plants will stay open, it could allow the Department of Agriculture to potentially force meat companies to fulfill orders from retailers, which would effectively keep some of them in capacity. And lobbyists for the meat industry said that the executive order, which will invoke the Defense Production Act, was significant because it created federal guidelines for the step plants needed to take to prevent the virus from spreading, because until now, meat plants have just been forced to close based on the patchwork of regulations, and this could damage the U.S. supply of beef, pork, and products. So I think this is a really major step. I mean, having an executive order is better than having none. And yeah. So the second thing that I'd like to talk about today is that California's Governor Newsom have reviewed a set of plans to reopening the state. The process of reopening will take in 4 phases. We're still in stage 1, where the government and private organizations are working to make it more consistently safe for essential workers, like grocery store employees or nurses, which would need more protective equipment and more robust testing and tracing system. Stage 2 will be when some lower risk businesses and public spaces can reopen, also with modifications to allow for social distancing. And this would include workplaces like factories, non-grocery retail stores, and schools and childcare facilities would also be reopened during this phase. Stage 3 will be when higher risk businesses will be able to reopen, including nail and hair salons, gyms, movie theaters, and sports without live audiences, as well as in-person religious services. Stage 4 will be the end of the state's stay-at-home order, and it will be when large crowds will be allowed to reopen. So stage 4 will be allowed only once treatments or a vaccine has been developed. So stage 2 apparently was weeks away, and the 3rd and 4th phases, according to Governor Newsom, are months away. And I think that while schools may open quicker than expected, they will be very different, and reopening schools and child care facilities is not only critical for the students, but also for the parents so that they can continue to be working and join the workforce. The third piece of news that I'd like to say is that the FDA plans to announce as early as today for emergency use authorization for the drug Remdesivir, which is being tested in treating patients with Covid-19. So Dr. Anthony Fauci, the federal government's leading infectious disease scientist, hailed early trial results of the drug from the National Institute of Allergy and Infectious Diseases, and he has expressed optimism on that it could make a difference in speeding up the recovery of some patients infected. The results was that the drug could shorten the time to recovery by about a third, and while a 31% improvement doesn't seem like a really a large number, it is a very important proof of concept because it shows that this drug can block this virus, which I think here is very optimistic and a very good sign. So the company that produces it, Gilead Scientists, said that it was aware of positive data emergency from the study by Dr. Foss's Institute, which was the which I previously mentioned, and Remdesivir was not yet licensed or approved in the United States or anywhere in the world, as it was originally produced to treat Ebola, but the clinical trial in Africa was disappointing. So here I would like to tell you how Remdesivir works. It works by basically acting as a RNA polymerase, and the coronavirus replicates by using these RNA polymerases, and as Remdesivir incorporates itself onto an RNA strand, it prevents further replication of the virus by stopping any RNA subunits to be added. So it basically halts the entire viral replication process, and as a result stops the coronavirus. So that's it. Thank you for listening, and I hope you have a good day. Thank you.